Hey guys, it's Reve again, back with another video. So this video is going to be, I guess, following me along on my workup process. So the workup is just the couple weeks that you have prior to your bone marrow transplant. They just kind of stack you up with lots and lots of appointments, and the goal is really to achieve a baseline before you go into treatment. So they check your eyes, they check your teeth, they do CT scans, x-rays, echocardiograms, ECGs, everything. Today actually was my first appointment. I had an appointment this morning at the Cross Cancer Institute here in Edmonton, and that was that was good. It was a CT scan. So a CT scan is a computer tomography, and so this is essentially getting a more in-depth x-ray. So rather than just getting one x-ray, it's kind of getting cross-sectional views of your body. It just gives you a better look at your body. And so they do this prior to your total body radiation. They said that, well, the guy the technician who was there explained it to me kind of, this is just figuring out your positioning. They do your measurements, they get you to lay on your stomach, you lay on your back. The actual CT scan itself only took about 15 minutes, but yeah, that went well. Everyone there was really nice. It's a very interesting test. You have to stay as still as you possibly can, and then you kind of go through this little donut looking machine, and it just slides you back and forth, and I guess that's taking the images that they need. Yeah, I also have 24-hour urine test, so I'm assuming you collect your urine for 24 hours and then drop it off at the lab, and they test for whatever they need. Yeah. Part 1 of my workup is now complete. Right now I am excited for the bone marrow transplant, at the same time very nervous, because it is a very long recovery process, and I've been trying to mentally prepare myself for that, but hopefully I will be ready when the time comes. It's just entering the workup phase kind of makes this bone marrow transplant stuff so much more real. It's no longer just an idea, something we might do in the future. It's happening right now. It's happening in less than a month. Stay tuned. Hey guys, I'm back here. It is my second day of my workup, my pre-transplant workup. So far so good. This morning I was up bright and early with my mom. We went to the optometrist first. I'll link as many or add as many photos into the video as I can as we go along, but yes, they do a whole bunch of eye tests. I haven't had an eye test done in probably about, I don't want to say it, but I swear it was like 10 years ago, because I remember I was much younger and they had to like hold me down to get the eye drops in. There's 3 people involved in it, and honestly, this time there wasn't that much difference. I hate the eye doctor, I hate eye drops, I don't like watching anything enter my eye, I don't like anything around my eyes. Like I don't think I could wear glasses or contacts in the future, because that would be painful for me. It would be a struggle. But yeah, so went to the optometrist. They do so many different types of testing. They do the basic one where you kind of list out the letters that you see from a screen, and they get smaller and smaller and smaller. I do that basic one. They also did test my tears as well. They put little pieces of cardboard paper in your eye, and they get you to close it, and you close your eyes for I think about 5 minutes, and then with whatever reading they're able to gauge how much tears you have in your eyes and how much you're producing, and that was normal. They also do then after that they do dilate your eyes. It took forever because, you know me, I was dodging the eye drops like that, but I tried my best to keep my eyes open, but it is a reflex. I just wanted them closed, but I did try my best. They got it in. They probably had to do 2 rounds of the dilating solution because it just wasn't all getting in. Sorry about that, but either way they were able to get the test done. And with this exam, the doctor essentially, she shone a light and she had a little magnifying glass, and so she would get me to look at totally different areas. We started with the right eye, and she'd say, okay, look all the way right, look top right, look straight up, look left, like kind of thing like that. And so she could get a view of every part of my eye. That one was alright. That test was fine, pain-free. It's just a little bit weird to be this close up to a light and the doctor, but that part was fine. They did some other testing where you had to put your eyes like right on this machine. It looked like goggles, to be honest with you, and then there was a little X in it. You had to follow the X and it scanned your eyes. And so they do this baseline eye exam because I guess after chemotherapy and radiation, after transplant, there can be damages and there can be changes. The doctor had told me in specific that it is a possibility that I could have cataracts in the future, and that's just a transplant thing. But in my family we don't have any eye abnormalities, so hopefully my chances for getting that are still pretty low. She did also mention that patients with sickle cell anemia should be getting their eyes checked yearly, just because of the smaller vessels there can become ischemic and eventually can lead to your retina detaching, and we don't want to get that far. But so definitely make sure you're getting your eyes checked a little bit more frequently than I have been. She had also mentioned that if I were to go through the transplant and get graft versus host disease, there is a possibility that you can get really dry eyes. Like she had mentioned, swollen eyelids, eyelashes, like your whole entire eye area is just swollen, red, maybe tight, itchiness, and then dryness on the surface of your eyes. And so she did give me these. I don't know how these are gonna work since I hate eye drops, but I honestly think if I'm in a situation where I need them, I'm gonna have to force myself to do them. So that was my first appointment. Thankfully my mom came with me because they dilate your eyes, you cannot see, everything is blurry, so I had a driver afterwards. Then for my second appointment we went to the dental office, and they essentially scan everything in your mouth to make sure they see everything in there. They check your teeth. They just want to make sure that you're going into transplant in tip-top shape. The doctor had said a concern there could be that because of the dry mouth that a lot of people experience after getting chemotherapy and radiation. So definitely let me know if this is something that you want some further information on. I can definitely do so. I can dig up all the paperwork that he gave me and definitely link them below if you were interested. But other than that, that was my day of workup. See you guys tomorrow. Bye.